Again at the insertion region, where I only see the cortex layer. I move up a little bit, so I move to proximal, and then I see an extra layer appearing. It's now really dark because I do the anisotropy. And if I angle my probe, then I see it more hyperechoic, and now I see it more hypoechoic. So if I do it like this, it's more hyperechoic, and if I do it like this, then it's more hypoechoic. So I do that. I look for the whole range of the tendon, so the whole width of the tendon. So this is the medial end of the tendon, and I go to the lateral part, lateral part, lateral part. This is the lateral end of the tendon, of the attachment. I go to the middle side, move up, move up, move up, until the tendon is not attaching anymore to the calcaneal bone. So here we are at the retrocalcaneal region, and if I go a little bit more proximal, then I leave the calcaneal bone, and this is Kager's fat bed. So this is Kager's fat bed. We see here the clear lines of the Achilles tendon, Kager's fat bed, and flexor hallucis longus muscle. I go up, I move up, I do it a little bit more with more speed. Here you can see the layers really good. So Achilles tendon, Kager's fat bed, and this is flexor hallucis longus. I move up, I move up. Okay, and now you see the soleus appearing. So I go back a little bit. This is just Achilles tendon, and we have to look in the medial part of the Achilles tendon, under the Achilles tendon. Here we see the soleus muscle. I move up, I move up. The Achilles tendon is going to behave like an aponeurosis, superficial aponeurosis, and this is the soleus muscle. Okay, we move up once more. Okay, this is Achilles tendon. It's actually more an aponeurosis. This is soleus muscle. This is flexor hallucis longus. I'm moving a little bit to the medial part of the lower leg. So I was here, and I'm going now to here, and focus on the aponeurosis of the Achilles tendon. And I see here a little structure. This little structure over here, that will become the plantaris tendon. But first, I want to go a little bit more proximal to the medial gastrocnemius muscle. And here still, this is the plantaris tendon. Now I rotate at the center of my probe is at the plantaris tendon, and then I rotate to a longitudinal view, and then I see 3 clear lines, and that is the longitudinal view of the plantaris tendon. If I go a little bit more to medial, then I lose the 3 lines, and they become 2. If I go a little bit more to lateral again, this will be the 3 lines of the plantaris tendon. And again, a little bit more lateral, I lose the lines, there will be 2. So this is the most standardized way, I think, to approach the plantaris tendon, to go from a short axis to a long axis. And I can go back to a short axis view. So this is then the medial gastrocnemius, and if I go to lateral, here you have the separation. Lateral isn't appeared yet, so we have to go a little bit up, and this is lateral gastrocnemius muscle. So that would be the Achilles tendon and calf muscles.